Meantime for you, it is flu season. Are you ready for it? You certainly want to prevent it if you can. So to tell us more about the illness and also some tips about it, we are joined now by Dr. Jack Ross. He is Chief of Infectious Disease at Hartford Hospital. Good to see you, Doctor. Thanks for being here.
Thank you, Logan.
So let's talk about it. It's the H1N1, otherwise known as the swine flu. Why did it get that name, and what do we need to know about it?
Generally, Logan, every year there'll be 3 strains of flu circulating, a couple of what we call A and 1B. The so-called swine flu is one of the A's that we saw back in 2009. It has some swine genes in it. That's how it got its name. And this year, as opposed to last year, it is the predominant strain currently.
All right. What are some of the symptoms?
The symptoms are fever of sudden onset and cough, sore muscles, achy pain, where you generally want to take to your bed. But it's important to note that not everybody may have all those symptoms. They may not have the fever. About 25% of us may have a milder case. And then some people actually will have a little bit of diarrhea or vomiting with influenza as well.
What's the difference between flu and the common cold?
The common cold, you have the sniffles, a little sore throat, maybe some headache. With the flu, you know you've been hit by it. Some people say it's like getting hit by a truck or by a bat.
Okay. A lot of people got the vaccine. Are they protected?
We've all been exposed to this dose of this type of flu over the last 4 years because it has been in the vaccine, but immunity wanes every year. Probably about 50% of us have been protected from our previous experience with the vaccine, but unfortunately less than half of us get a flu shot every year, Logan.
Is it too late to get one if you want one?
It is not at all. In fact, I would suggest that you go to your local pharmacy, your physician, the clinics, get your flu shot. It takes about 2 weeks to be protected, but flu season usually peaks mid-February to end of February here in Connecticut.
Are there some people who should not get the flu shot?
Generally, if you're less than 6 months old, it is not recommended, but for the rest of us, it is.
They obviously have the flu shot. I think they now have something where you can take it through the nose, right?
Up to the age of 49, they have something called Flu Mist, which is actually intranasal if you are afraid of the shots. And we also have a flu vaccine that uses a much smaller needle to be offered as well.
Is one better than the other?
They're generally not. Most flu shots have the same ingredients in them, the same strains. It's more personal preference and what's available.
And the flu shot doesn't get you sick, is that right?
The flu shot's an inactivated strain of the virus. You cannot get sick from a flu shot, but you can get achy, a little low-grade fever, and you can have a few other symptoms as well.
How does the flu spread?
The flu is spread by droplets and by contact, where if we cough, we sneeze, people around us can be exposed by touching surfaces, perhaps rubbing our nose, our eyes, and those areas. So for the most part, you want to cover your cough, perform good hand hygiene, stay away from those who are sick, and stay home if you are sick.
Let's say you get it. How do you treat it?
If you get it and you're a normal, healthy adult, you stay home, stay away from other people, lots of fluids. You can consider taking Tylenol or non-steroidals like Aleve or Nuprin. If you have other co-medical conditions, or if you're elderly or pregnant, you may want to see your physician because there are medicines that will shorten the course.
Is there a prescription drug that you could take if you don't have any other problems?
There are 2 prescription drugs that are available through your physician if you have other conditions. Some physicians will use it for all cases of flu.
Sometimes you see these different over-the-counter medications. It's Theraflu, it's NyQuil, it's these kinds of things. What do you think about those?
I think most of them will have Tylenol and other ingredients in them. They may make you feel a little bit better. They may make you sleep, so you'll get some rest. But for the most part, fluids and Tylenol work well for influenza.
Soups and things like that as well?
Soups and fluids are great.
What about Gatorade? I've heard that.
People like Gatorade because of the electrolytes in it, and they feel in the sugar. It substitutes for eating the soup or other things.
Can this flu be severe?
Flu can always be severe. It depends on the underlying host, and in some years, some populations may be targeted more. With swine flu in 2009, we saw it in people who were pregnant, younger, middle-aged, obese, for whatever reasons.
But generally, it just lasts maybe 4, 5, 6, 7 days, and you know it when you've got it.
You know it when you've got it, and you can have fatigue for 10 to 14 days afterwards.
All right. Dr. Jack Ross with Hartford Hospital. Thanks, Doctor.
Thank you, Logan.
Good to talk to you. Hopefully we won't be getting it this year.
I hope not.
I know I've had it in the past. It is no fun. Still to come right here on the Fox Connect.